Welcome back to another episode of Casa Café Chats. This is a health and wellness podcast to help you get tips on living your healthiest and best life. On this week's podcast, we'll be covering hunger and homelessness. At this time of year, we're getting ready for the holidays. Many of us are preparing our Thanksgiving dinners with our families next week. We're thinking about all the yummy recipes we get to have with our families and relaxing at home and just enjoying this season. It's a wonderful time. And the reality is that there's many people in our community that are not that fortunate. According to the National Alliance to End Homelessness, in 2019, over 500,000 Americans didn't have a place to call home. With the drastic changes COVID has had in our lives, experts are predicting that number may look higher this year. The COVID-19 pandemic has only increased the struggles of homelessness and hunger, as many local individuals have lost their job and been hurt by the downfall of our economy. Actually, homeless individuals are one of the most vulnerable populations in the COVID-19. Today, we're showcasing the team over at La Posada to talk about these social issues. La Posada provides interim housing to restore families who are experiencing homelessness to stable and permanent living situations. This program provides child and adult services, transportation vouchers, nutrition education, and financial management, to name a few, to help families regain and sustain self-sufficiency. So with me to talk more about Hunger and Homelessness Week are Doreen Herrera-Gauger. She's a supervisor over at La Posada. Angelica Dichosa, she's a supervisor over at La Posada. Angelica Dichosa, she's team leader and case manager. And Oscar Fuentes, education program supervisor. So starting off, Doreen, I know you've been part of this project for about 7 years now. First off, thank you for your advocacy. Could you give us an essence of what Hunger and Homelessness Week is and why during this time?
Thanks, Natalie. The National Hunger and Homelessness Awareness event takes place annually the week before Thanksgiving. The hope is that people take the time to not only reflect on the things that they may be thankful for this year, especially during this pandemic, but to also think of others who may not be as fortunate and how they can help. Over the past 7 years, our program has focused on a topic or current events that highlight the many facets of people experiencing homelessness. Some areas focused on in the past were LGBTQ youth, people with mental health conditions, homeless veterans, and natural disasters such as Hurricane Maria in Puerto Rico, earthquakes in Mexico, and California wildfires. This year, we would like to address COVID-19 and how it has affected hunger and homelessness. We are fortunate to have a family shelter program at Casa Central that provides apartment-style living for 22 families. When families come to our shelter, they are so thankful that they can cook their own meals, take a shower, and take the comfort in knowing that their family unit is intact and their children are in a safe place.
Now, when you say homelessness, what really defines being homeless?
Defining homelessness is not something you can just narrow down in one definition. There are many factors someone is experiencing homelessness. How the city of Chicago defines homelessness is divided into 4 categories. The first one that many are probably familiar with are those who are fleeing domestic violence situations that forces individuals and their children out of their homes. The second is homeless under other federal statutes, which would be considered youth ages 16 to 24 years of age, who are living on their own without a parent or a guardian. Most often, they move from 2 or more times in 60 days and can be expected to continue to live under these circumstances for an extended period of time. Those who are imminent risk are individuals or families who will be losing their residence within 14 days. Example of this, they could be going or also doubling up or temporarily living with family and friends for short periods of time. The last one are individuals and families who are literally homeless and they do not have a residence at all. They live in public or private spaces not meant for human habitation. Example would be a train, a car, an abandoned building. They also live in shelters, hotels, and also could be exiting from an institution, for example, jails or hospitals. Casa Central La Posada serves families that are under all of these categories.
Wow, so who are those primarily affected? And thinking locally, how does this issue compare in Chicago?
Based on All Chicago's Homeless Management Information System report 2018 to 2019, 76,998 Chicagoans reported that they were experiencing homelessness. 67% of this group reported doubling up in homes with other families or friends due to hardship and are often in overcrowded conditions. Of the Chicagoans who are experiencing homeless, only 30% are actually using homeless service system or shelters. Chicago Public Schools, or CPS, reported serving 16,451 homeless students during the school year of 2018 to 2019. As seen in the chart from the Chicago Coalition for the Homeless, among the Chicagoans experiencing homelessness, 30,681 were identified as family households and 399 were identified as single individuals. In addition to the 16,451 children experiencing homelessness reported by CPS, unaccompanied homeless youth ages 14 through 24 totaled at 16,580 individuals.
All right, so these numbers are pre-pandemic. Given the stress that COVID-19 pandemic has put in our lives, how has this changed? And I think the obvious question is, how can you follow a stay-at-home order if you do not have a set home? What does that look like?
This year in 2020, COVID-19 is creating a health and economic crisis that have affected the numbers of individuals and families experiencing homelessness. Even though this year has not come to an end yet, the predictions are that the cases of COVID will rise for those who are experiencing homelessness. According to the CDC, those experiencing homelessness are at risk of becoming seriously ill from COVID, especially the individuals who are adults over the age of 65, individuals with pre-existing health conditions, which many of our clients and persons who are experiencing homeless do have pre-existing health conditions, pregnant women, and children under the age of 1. Just try to imagine being in the shoes of our participants during the tea and the city to self-quarantine, social distance, and staying at home. They're difficult, if not impossible, to follow when you don't have a home.
What about our other living essentials like food? Through this time, many people are facing hunger. I know that there's a term for this, and you probably have heard it before. It's called food insecurity. Oscar, could you explain this term in more detail?
The U.S. Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an active, healthy life. At the same time, food insecurity describes the inability to provide enough food for every person in a household. Something else to consider is the difference between hunger and food insecurity. Hunger is a physiological feeling. On another end, food insecurity is one way to measure and assess the risk of hunger. For example, in the United States, before COVID-19, research shows that 35 million Americans were struggling with food insecurity. 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 35 million Americans were or 1 in 9 people struggle with hunger. During the pandemic, the numbers skyrocket, with more than 54 million Americans, or 1 in 6, are currently experiencing food insecurity this year. Food insecurity has its causes and effects. The causes among them are layoffs at work and unemployment, low-income families who pay bills or have to decide to buy food, lack of transportation or lack of resources, or they do not qualify for government assistance, such as immigrants and so on. Food insecurity also has its effects. Health concerns, for example, malnutrition, chronic and unexpected conditions such as diabetes, heart disease, bad blood pressure, and everything related to those illnesses. Another important effect is toward children. It damages their ability to learn and grow. Additionally, it also creates difficult decisions for seniors, often living on fixed incomes, and they many times choose between paying or food or for critical healthcare. And that is what it is.
Does food insecurity impact specific groups? Who is the most affected?
Food insecurity, according to the U.S. Department of Agriculture, is often rooted in poverty, and that includes the homeless population. However, it has also been found that food insecurity has affected the middle class population. In our research, we found that the most affected communities are African Americans, Latinos, followed by Native American, white Caucasians. Before the pandemic, Latino individuals were almost twice as likely to live in food insecure households as non-Latino white individuals. 15.8% of Latino individuals were experiencing food insecurity compared to 8.1% of white individuals. Food insecurity has always been disproportionately high in communities with large Black populations. Before the pandemic, 9 of Black individuals were food insecure, compared to 8.1 of white individuals. That means that the most vulnerable members of society are in position to fare the worst. The individuals who are for serious illnesses associated with COVID-19 includes seniors, people with chronic illnesses, and people of color. It is also important to mention that globally, food insecurity decreases the ability of countries to develop their agricultural markets and economies. Access to quality, nutritious food is fundamental to human existence. Secure access to food can produce wide-ranging positive impacts, including economic growth and job.
This pandemic, I'm sure, has had some sort of imprint on this. How has food insecurity changed because of COVID?
During the pandemic, the numbers surged to more than 54 million Americans, or 1 in 6 individuals. It is estimated, however, that if the pandemic continues strong in early 2021, that number could change to 1 in 4 individuals experiencing food insecurity, or over 62 million Americans could be greatly affected. Through our research, we found that from February to May, the pandemic sidelined 14 million workers in the United States. At the same time, by June 2020, many of those workers had lost jobs with employer-sponsored insurance 19 pandemic. These health plans cover over 6.9 million dependents, including children, affecting over 20 million individuals in the United States. Another fact that we found was that from March 2020 to April 2020 alone, the amount of people using SNAP benefits grew by 15.8%. Nearly 43 million people were forced to rely on SNAP benefits by April 2020. I mentioned before about the African communities experiencing food insecurity around 19 and 16% respectively. In the Native American community, for example, in a county in Alaska is projected to have the highest child food insecurity rate at 0.9% and the second highest overall food insecurity rate at 34.8% in 2020. This occurrence is driven by above average unemployment and poverty among Native Americans resulting from history of persistent geographic displacement and damaging federal policies. In summary, people from every race, from low, middle, or higher income, have been affected since the pandemic. Many of them are using money from retirement savings plans to pay their bills, are getting food from food banks, and since many have lost their job due to the pandemic, they are short in income to pay for rent or mortgage. Practicing social distancing is the key.
All right, Doreen, after learning about all of this, I think many of us have the same question in our mind. What can we do to help?
So, what can you do to help? If I may be so bold, I'd like you to take the time to acknowledge the next person you meet on the street who is experiencing homelessness with a smile. This action alone can make a difference in that person's day. Aside from this action, there are many other ways to help people directly and indirectly. Volunteer work, advocacy efforts, financial or material contributions, and continued education are all important and needed to make a difference. Volunteering your time at a local homeless shelter or food bank would normally be a good suggestion. However, due to the pandemic, many of these places have reduced the amount of people allowed inside for safety reasons. If in-person efforts aren't possible, then you can always ask them how you can help. The Greater Chicago Food Depository partners with over 700 food pantries, soup kitchens, shelters, and mobile distributions to help serve food to people all across Chicagoland area. Some shelters may need help fulfilling a wish list of supplies needed for their participants. Or you could help organize a drive, a coat drive, personal hygiene, or even socks. Yes, I said socks. How often do you think a person experiencing homelessness who lives on the street gets a chance to change their socks every day? I guarantee you, not that often. It's possible that that one pair of socks could be worn for days, if not weeks. Being able to change into a clean pair of socks would be greatly appreciated. Volunteer at your local, state, or national housing or homeless advocacy coalition, or make a financial contribution to support their work. For the name of the coalition nearest you, you can look at the NCH's Directory of Homeless and Housing Advocacy Coalition at http://www.nationalhomeless.org. You could also attend neighborhood and public meetings to speak up in favor of low-income housing, shelters, and homelessness prevention programs. You can continue to educate yourself in these matters so you're well-informed and continue to pass the knowledge to someone else. People within your community will benefit greatly from a compassionate and informed point of view.
Sounds like we have some work to do, listeners. We appreciate your advocacy for this, and thank you, Doreen, Angelica, and Oscar, for your work in bringing awareness to hunger and homelessness in times of COVID. All the resources will be linked in the description box to this podcast.
Thanks, Natalie. I hope this has inspired many of you to feel the need to want to do something for others. There's always a need for someone to care. There's always a need to have your voice heard. And there's always a need to make a difference in someone's life. Thank you so much for listening, and take care.